Good morning. Today I am going to share some test security information with you for our fall STC test security training. We're not going to get into the weeds of all the assessments during this time because everything is so new this year, but I wanted to give you the basis so that you could actually have a training with your staff. You can actually use this video with your staff as we move forward. Just as a note, at the end of this training, you will have a quiz that you will need to pass with 80% in order to certify as a secure testing site. If you do not pass with the 80%, we will have to do some one-on-one training so that we can verify that. So we'll keep moving on with this PowerPoint. I'll provide the PowerPoint and the video of this presentation for you. So New Mexico Administrative Code, which is otherwise known as NMAC, that kind of guides or governs the testing is 6.10.7, which is NMAC Standardized Testing Procedures and Requirements. There's roles and responsibilities, licensing, test administration, security. There's also NMAC code for demonstration of competency and graduation, and for standards of excellence. The one we're going to focus on today is right here in this 6.10.7, knowing that all of these others are connected in some aspect, so it would behoove you to look those up. And so the flow of procedures, we have our state code and our procedures in place. We want educators to know the statute, code, and the procedures. Test administration and security procedures are followed. Students demonstrate what they know and what they can do. And we have valid test results. This helps inform instruction and ultimately provide valid information as we make decisions on the best way to educate our students. So here's a flow chart on roles and responsibilities. I'm not going to spend a lot of time on the weeds, but as an STC, you actually fall right in this blue area. So we have PED, and under school district, that is me, and Renee for end of course in that aspect. And of course, Mr. Parks is ultimately at the top of that food chain. And so then we have you as STCs, then we have our TAs, which are test administrators, and we have our proctors. Charter schools have a similar flow as well. So this is an important slide for you to look back at later. Our DTC, here's what license are required and the responsibilities. Our STCs as well. Test administrator, they have to have the same as the STC. You cannot have a long-term sub administer a state assessment. They can cover a class while a certified teacher administers. Your proctors can be anybody who's trained. It could be an EA. So our roles of our responsibility, he is to appoint the district test coordinator and the technology coordinator, which if you don't know, that's Andrew. We have to update that information every year. Mr. Parks actually signs a verification every semester in regards to testing. Did we follow test security? Did we do staff trainings? Did we do accommodations? And we fill that out 10 days after training. DTCs are the voice, the liaison between PED and the vendors. So unless the DTC tells you to call, you should not be calling. That comes strictly through our office. But there's times when I will have you call because you have some specific information. And that's more towards the vendor when you're troubleshooting than with PED. I generally handle all calls through PED. And so as a source of assessment information for our district, we're fortunate to have Renee on our state assessment committee, so we tend to get information a little faster than others. But I do have to say that PED has improved their communication. We get a weekly email, and generally that information is pretty up to date. I do try to send that to you if I feel like anything is pertinent. So the DTC has to attend all mandatory trainings. We have to develop district test security policies, which is what we're talking about today. And I have to train you as STCs and all personnel involved in testing. And then there's technical requirements, pre-ID data, accommodations, etc. There's a long list of duties. We also have to keep our documentation for 5 years. So what we've done is we used to do paper folders. So any of those paper folders have been archived. We actually scanned them all into the Google Drive, so we have them. That way, if we get audited, I don't have to come and bug you at your campus. I can just pull up that information. Your principals, which in our elementaries or in all of our schools, you're the head STCs. You may have somebody assigned to help you, but in our district in Hobbs, the principal is the school test coordinator, and perhaps some of you have another person, but ultimately that responsibility falls on you as principal. Verification, again, test security, staff trainings, accommodations 10 days after testing, which we usually do here. And then forms that you fill out are not sent to PED, they are sent to the district test coordinator, such as irregularities, those types of medical exemptions. Do not bypass the DTC. School test coordinators, they attend trainings that the DTC deems mandatory. And ensure district policies followed. Have their TAMs, which is teacher manuals, at least a week before. And then you make sure that confidentiality agreements are filled out. Those are already in your Google Drive, so you should have them printed and uploaded, especially elementary that you've already done iStation. That should have already been done. If you haven't, please do so this week. You have to ensure that we have our testing locations. We have a 25-to-1 ratio, and materials have been removed and that could possibly answer any questions. We have submitted a waiver for secondary for the 25-to-1. In the past it's been granted, but I will say we got questions this year and that may not happen. So what I would do is make your schedules based on 25-to-1, and then we'll be blessed if they do approve it. So district policy at least has to be as rigorous as the state. We have to maintain secure materials. Scheduling, we have to make sure enough breaks, paper-based testing allowances, and computer-based testing allowances, because those are different in terms of scheduling. Irregularities. So if something happens at a campus, a testing irregularity, the DTC is supposed to notify the PED within 3 days and then conduct an investigation. The irregularity report must be completed within 10 days. I like to do that within the 3 days myself, unless it's a huge investigation. Otherwise, you lose track of which accommodations you've sent in and which have not. And then we decide if the irregularity is valid or invalid test. That they usually go with our district recommendation. This year, again, they have something new. There's a workflow, so irregularities will be done digitally. And so I've already kind of been working on the bugs of that and given your principals, your STCs access for that. As we get closer to testing, we will train. And it may even happen that you don't need it, which is what we are shooting for, that we would like to have 0 irregularities this year. So DTC contacts the PED program manager. And this is just the workflow. I'm not going to bore you with all those details. You can read. So how do we avoid irregularities before they happen? Scheduling is one. We schedule sufficient time to complete before lunch or at the end of the day. Students cannot test after hours. So once the school bell rings, they should end their test. They can, unless it's written in the IEP that they can test over multiple days, they cannot pick up the test the next day. Or if a rare instance that they're sick, they threw up, had to leave for those types of reasons, then not because of sports events or anything like that, can they start the next day. Before testing, make sure that the student IDs are on the label tickets, the correct ticket. Accommodations and accessibility features are assigned. Really have to check those accommodations. Sometimes those roll over from years past and it's not always accurate. So you really need to check every student's accommodations. Technology, we have to make sure everything is ready. Students need to be authorized to use electronic devices, and you have to monitor actively. So the best thing is to just be prepared and check those accommodations very closely. Not wait till the last minute, not just let your teachers tell you. As a school test coordinator, you need to be sure that accommodations are 100% accurate. Again, 100% accurate. That is your role and responsibility. This is the old irregularity form. It will look different in the online portal. Voids versus invalidate. The state has really pushed us to change our terminology in terms of how when we turn in our test irregularity. So if we have a voided test, that means a wrong test was started, it needs to be voided, a correct test assigned and completed, the score is valid. To invalidate a test, the test was completed, the score was not valid because of cheating accommodations. So sometimes if a student starts a test with the wrong accommodation, we're going to invalidate that. Okay, we're not going to void it. We want to just invalidate it and assign them the correct test. We're not going to get lost in the weeds again here because when we submit that, the state will tell us which one we need to do. So accessibility supports. Many of our platforms or our portals have excuse me, accommodations or tools that all students can use, such as a magnifier or a highlighter, different features. So that's for all students. Accessibility features are designated students. So there will be certain ones that you want a blue background, you want a pink background, whatever is normally happening for that student, not just because they like pink and blue because that's their favorite color. And then you have those that are available because of an accommodation or a status, such as an IEP, a 504, or an English language learner plan. So universal tools are for all students. Computers, they're built in. Okay. Examples, blank paper, answer eliminator, a highlighter, a calculator on specific things that are allowed, or zoom magnifier. Here again, I talked about the color contrast, directions, those types of things. Headphones as a noise buffer, human reader, text-to-speech when it's allowed. And then we have those specifically for our students with IEPs, which there's a typo, or 504 plan or ELs, only if it's assigned and used in instruction. This is really important. We only assign those accommodations if it's used in instruction. So required by law is the IEP document. If an accommodation is in there, teachers must be following it. So you can't assign an accommodation if it has not been used in the classroom. That is unfair to the student. And so an accommodation, there's a difference between accommodations versus modifications. Modification changes the way the construct of the test, and it provides a different result. So you can't use a dictionary unless it's just a word-to-word one for ELs. Paraphrasing a test question for a student, you can't say it in other words so the student can understand. It has to be read as it is written. Sometimes we have non-standard and emergency accommodations, such as a cell phone for blood glucose monitoring. Homebound students sometimes will test at home. If those need to happen, they have to be done at least 2 weeks before the test. Now, in emergency accommodation, we've had this happen. If a student breaks an arm and can't write or use a mouse, and then a non-standard accommodation form if not. So those are what we use. We attack those based on individual basis. So when that happens, just call me and we'll make a plan. But you have to prepare ahead of time. If you know that a student is on a glucose monitor and they use their watch or their phone, you know that now, most of the time. That needs to have a process in place beforehand. So accommodations and irregularities. Administering an assessment with an accommodation that is not in a student's legal plan is an irregularity. Administering an assessment without an accommodation that is in the student's plan is an irregularity. Avoid irregularities by checking and double checking with which accommodations are assigned to students. There's a little flow chart on decisions about accommodations. This can help if you do not have that process at your campus. Participation, it's expected that 95% of students participate. We do allow for some medical exemptions. I will tell you, if a student has not tested over the last 3 or 4 years because of medical exemptions and we keep applying, the state has denied some of those in the past. English learners, we have accommodations except on Access, which is an English language proficiency exam. They have an ELA exemption for the first year in the United States schools. And then if it's available, they can test in their home language of Spanish for up to 3 years. Here's a flow chart that can help you make some decisions. I will be sending out information soon on students who will test in Spanish and those students who need a waiver because they need another year of testing in English. So we will get to that in the next few weeks. Medical exemption, serious illness, injury, or medical emergency. We have to have a form filled out. That entire form does not get submitted to the PED. It's also now going to be a digital format. We have the paper copy that we will keep on file, and then we have a test coordinator portal we will submit those through. Here's something for iStationers, which is our kindergarten or K through 2. We have the on-demand assessment available if you want to administer the ISIP more than once a month. During benchmark months, when they pull data, they pull the first administration. To use an on-demand for the benchmark, so during September, January, and May, we have to submit an irregularity. We haven't done that in the past, but that's new requirements. And then report irregularities only in benchmark months. So something goofy happens in those off months, we don't have to report it to the state. You do have to use the test administrator script for all administrations of the ISIP assessment. So in a progress monitor, or if a student's doing a makeup in a teacher's classroom, the teacher must read the script word for word. That's a requirement. And when in doubt, ask. Give me a shout, give me an email. Don't just assume. We all know what happens there. So I've gone through these slides. You can go back through the video. You can pause it to read those slides a little more in depth. I will also provide you with a PowerPoint. And you will need to take a test and be sure that you complete that assessment with a % of an 80. It will be a Google Forms quiz.